Today, we're diving into a crisis that's unfolding, for the most part, completely out of the global spotlight: the collapse of Sudan's mental health system. It's a story of a system that was already fragile and is now shattered by war, but it's also a story of just incredible human resilience. Our guide through all of this is the really comprehensive research of Dr. Mohammed Salah Al-Faha. Okay, let's get right into it.
To really get a sense of the scale here, just start with this one number: 60%. Since the conflict exploded back in April 2023, more than half of the hospitals in the capital, Khartoum, the nation's entire healthcare hub, have either been damaged or shut down completely. I mean, think about that. The very heart of the country's medical infrastructure has literally been ripped out.
So this brings us to the big question, right? The one we're really digging into today. When the very places people go to heal become targets, when doctors and patients are forced to become refugees, what happens to the psychological well-being of an entire nation? This isn't a hypothetical. This is the reality for millions of Sudanese right now. To understand how this system could just shatter so completely, we have to look at the foundation it was built on. Because the truth is, the current conflict didn't break some perfect, well-oiled machine. No, it broke a system that was already struggling, a system with deep, structural cracks that had been there for a long, long time. And what's really remarkable, actually, is that Sudan has this history of real pioneers in mental health. You had visionaries like Professor Tigani Al-Mahi and Dr. Taha Bashir who worked to bring care beyond the capital city. And more recently, the 2018 Mental Health Act was a huge step in the right direction for protecting patients. But, and this is a big but, despite these bright spots, the system as a whole was just incredibly vulnerable. And this slide really gets to the heart of the problem. Everything was in one place. For decades, you basically had two different Sudans when it came to mental health. In the capital, Khartoum, you had the major hospitals, the specialists, the training programs, the whole shebang. But for almost everyone else, in all the rural areas and conflict zones, there was little to nothing. People had to rely on traditional healers, not necessarily by choice, but because the formal system, it just didn't exist for them.
And on top of that, the system was bleeding out its own future. Just wrap your head around this for a second. For every 4 psychiatrists who finished their specialized training in Sudan, 3 of them left the country, mostly for better opportunities in the Gulf states. This brain drain meant the country could never ever build up the workforce it so desperately needed. Okay, so you've got this incredibly fragile system full of these chronic, long-term issues. Now let's see what happens when you hit it with an acute, catastrophic collapse. This is what happened when war came to the capital in April 2023.
This was the moment everything changed. The conflict between the Sudanese Armed Forces, the SAF, and the Rapid Support Forces, the RSF, erupted, and Khartoum, the one place where all that specialized mental health care was concentrated, became the epicenter of the fighting. The nation's healthcare hub turned into a war zone. So the crucial point here is that the one pillar holding up the entire national system, Khartoum, it just crumbled. Before the war, it was the hub. It had its flaws for sure, but it was functioning. After, a total landscape of destroyed facilities, displaced doctors, and a population just stranded without care. Access to psychiatric services in the capital essentially vanished. Overnight. You know, a system collapsing isn't just some abstract idea. It has a real, devastating human cost. And to understand that, we're now going to look at some findings from a study Dr. Al-Faha conducted on internally displaced people, or IDPs, who managed to flee the fighting and find refuge in Port Sudan. And the data from these shelters, well, it paints a truly devastating picture. First off, this is a crisis whose burden is falling overwhelmingly on the shoulders of women. Nearly 92% of the people in these shelters were female. As they were fleeing for their lives, more than half of them, 55.8%, either experienced or witnessed deeply traumatic events. And on top of that unimaginable trauma, there's the desperate daily struggle just to survive. Nearly 70% of people reported having no access to the absolute basics, like food, water, or shelter. So you have all this need, all this immense suffering, and what's the result? A staggering treatment gap. Just 20%, only 1 in 5 people, had received any kind of mental health support at all. And when you break down what that trauma actually looks like, it's just heartbreaking. The most common wound, reported by nearly 70% of people, was losing family or friends. After that, direct psychological trauma and abuse. You see, it's not just one thing. It's this multi-layered suffering, this cascade of loss that defines the experience of displacement. But, and this is so important,
Amidst all of this darkness, there's an incredible story of strength. The system may have collapsed, but the human spirit has absolutely not. So this next section is all about the remarkable resilience and coping strategies of the very people who have lost so much.
So how on earth do you survive this? Well, Dr. Alpha Hall's study found that people are tapping into this deep well of resilience. Faith and spiritual practices like prayer are a cornerstone. So are those community bonds, relying on family, on friends, on neighbors. But it's also about agency. It's about taking back some control. People are engaging in daily activities. They're volunteering, selling pastries, starting tiny businesses. And you have to understand, these things aren't just about making money. They are acts of reclaiming normalcy and purpose in the middle of total chaos.
And that resilience, that's the foundation upon which a new system can be built. But it can't happen on its own. So now we're going to zoom back out and look at the strategic blueprint for not just repairing what was broken, but for building something much stronger, more equitable, and more resilient for the future.
So the path forward has to be a multi-pronged strategy. It starts with policy, actually enforcing the laws that already exist by creating a national commission. Then you absolutely have to break that cycle of centralization by building regional centers and using mobile units. It also means integrating mental health into primary care, training general doctors to handle common issues, a model they call task shifting. And of course, you have to tackle that 75% brain drain with real incentives, like better salaries, to keep specialists in the country. And finally, you have to secure the funding to make it all happen. That's the roadmap.
And that leaves us with this one last thought. The people of Sudan, in the face of unimaginable loss, have shown incredible strength, agency, and resilience. The question for the rest of the world is a simple but profound one. Can the global community's commitment and support rise to match the resilience of the very people it aims to help?